Well, mental health issues form a significant part of our workload and are a growing part of our workload. So anything that offers an additional option to manage such patients is really helpful. So that's the first thing. It's an additional option. It's another thing that we can utilise to try and support and help our patients. Well, gold standard care, I think, for any aspect of the patient journey has to be seamless care. So I think we would want to have a system whereby the patient wasn't aware of any barriers to care. So they would present with their GP, the GP would make an assessment and they would get referred, and whether that was to services within the practice or to secondary services, whatever, the patient would move through the different services in a seamless and easy manner that didn't create any barriers to care for them.
I have sadly lost 2 family members to suicide in the past year. I went to my GP because I knew that I was struggling with the impacts of those bereavements, as well as the death of my brother. My GP offered to refer me to counselling, an offer I took up. It was provided by the Belfast Health and Social Care Trust in another part of Belfast to where I live. I was given an appointment within 2 weeks of being referred. Following that block of counselling, I asked to be provided with support closer to where I live, and I was referred to a support group for the families of bereaved by suicide. I was very pleased with my treatment from my GP. Initially, I had found it really difficult to open up to my GP about how I was really feeling. He offered me medication on my initial visit, but also referred me to counselling. I think every GP practice should have a counsellor based in the practice. I think it is more intimate if it is provided in this familiar setting. I also think that every GP practice should have a mental health worker based in the practice, and their trainee GPs should have to do mental health and suicide prevention training as part of their training.
Counselling can help people to understand how they're feeling and why they're feeling that way, but even more importantly, it can help people to figure out what to do to improve their moods and to reduce their anxiety.
As someone with lived experience, I'm a passionate advocate for talking therapies. Over the past couple of years, I have engaged with a number of talking therapists, each one dealing with a different piece of my complex jigsaw. Individuals who were in my life in 2017 were treating me in such a way as to distress and degrade me, and my sense of self-worth had become so low that I didn't really believe the doctor would care about me. In addition to this, my GP practice didn't really seem to know what to do with me. On one occasion, I phoned the practice in despair to ask for help because I didn't believe my antidepressants were working and was told off quite severely by the nurse who triaged me. I was told I would have to wait 2 weeks to see the GP to have my meds reviewed. Later on, I made an appointment with the GP and gave him back the meds, saying they weren't helping. He prescribed me even stronger antidepressants of the same type. Within a few weeks, they'd caused me to develop a heart arrhythmia and to have to be seen by the out of hours to be taken off the meds. During all of this, I was never referred to community mental health services, even for screening. My situation became more painful in terms of the problems I was facing, and my husband, mother and sister all became very afraid that I was going to lose my battle with depression. They each individually contacted my GP and were told there was nothing the practice could do. If they were really afraid, they should take me to the rapid response team in A&E. In the end, my sister phoned the Ulster Clinic and I was seen by a psychiatrist there at the cost of quite a lot of money. The psychiatrist gave me a full assessment, diagnosed me with 2 mental illnesses and suggested that I should also be assessed for ASD. He also identified that I was on the wrong kind of drug. I needed a different type of antidepressant. He devised a treatment plan with me and he wrote a letter to my GP detailing all of this. The new drugs were issued. My husband pushed the GP hard to make the referral, and with the backup of the psychiatrist's letter, I got referred through. I then waited 3 months to be screened by community services, but thankfully, during that time, I was on meds that were working to improve my moods and my sleep. It's very sad that there are so many GP practices which don't offer talking therapies. It's even more sad that in Northern Ireland we don't have a specific mental health training course for GPs. It's essential that people with lived experience tell their stories and find a way to act in solidarity. We need a collective voice if we're going to make a change to this situation.